I'm Nicola Garda, and my work in broadcasting at the BBC gave me a real passion for the telling of stories. I think being able to connect through something which we all have in common creates a conversation where we can invite everyone to join in, and perhaps then we don't feel so rare after all.
I am Maria Angels Ferrer, and I have also a real passion for stories, hearing them and sharing them in ways that makes us all feel better about ourselves. Besides having an accent from Catalonia, I consider my job to be a detective of preferred stories. Hopefully, this becomes clear as we all listen many different stories.
Today we are recording another rather unique episode of our podcast. We will be taking our conversation online and using Zoom to connect with our guests in order to all stay at home during this time of lockdown. In this episode, we are very excited to be joined by our guest, Dr. Shubha Padkey, Professor and Head of Medical Genetics at Sanjay Gandhi Postgraduate Institute of Medical Sciences in Lucknow. Dr. Padkey has an experience of 30 years in the field of clinical genetics and laboratory genetics. She has contributed to the establishment of the specialty of medical genetics in India by training most of the medical geneticists. She is also founding president of the Society for Indian Academy of Medical Genetics. We also have listening and will be taking part in our conversation later, Suyong Sathe. Suyong is an engineer from Mumbai and is currently receiving ERT for Gaucher disease. And joining us from Manchester is Dr. Charu Deshpande, consultant clinical geneticist who moved from London to join the clinical genetics team in Manchester. And we have a member of our Whitworth Group team, Dr. Rona McLeod, consultant genetic counsellor. Both Charu and Rona are part of the neurogenetic team in Manchester. So because this conversation is so important and we want our listeners to get the best out of it, then we're going to be mindful of our environment and a little bit more disciplined with our time and structure so that we allow the tech to keep up with us.
So basically I'm from Mumbai, India, and I was the first patient in India to be diagnosed with Gaucher disease, which is one of the most prevalent lysosomal storage disorders. And I was also the first patient to get treatment in India. So it has been a very difficult journey, right from the time of the diagnosis to getting the treatment, because being the first patient, myself and as well as my family were all alone. We did not have any help or guidance. The situation is much better now because we have so many support groups, but at my time we were all alone.
We will be hearing more from Suyong later. Our story starts with Dr. Shubha Padkey. So welcome, Shubha, and thank you for taking time in these very unusual times, actually, at the moment, to talk to us. And it's great to be able to connect and have the opportunity to share all of our stories. I'm sure we'll all end up sharing something about ourselves or what's happening at the moment and our own lived experience of rare conditions. So it would be great to have a conversation around that, and internationally too, which is very exciting. So I wondered, Shubha, whether you could introduce yourselves and just tell us a bit more about yourself and your connection to rare conditions.
Thank you for inviting me, and it's a very a nice opportunity to get connected to you all. Thanks again. Thanks, Charu. I am basically a clinical geneticist or medical geneticist with pediatrics background. And I'm working in this area of medical genetics for more than 3 decades. And as you know, 80% of the rare diseases are genetic disorders. So practically, other than thalassemia and Down syndrome, all our patients are rare diseases. So when we think of genetic disorders, I think 99% of genetic disorders are rare disorders. So naturally, nothing unusual. Even probably when I started working in genetics, I was not aware of this concept of rare diseases also, but just it was interesting, and really later on we realized that diagnosis of each rare disease is such a challenge that it is a very interesting part of dealing with rare disorders as a clinician, other than, of course, the need to diagnose each case and try to help each and every patient.
Where did that interest start? When did you start thinking about genetics, and within your personal life or your professional life, when did that kind of begin?
But by chance, I landed up in this place called Lucknow, where the institute, Sanjay Gandhi Postgraduate Institute, which came up about 35 years ago, had started first department of medical genetics in India. And then I just joined as a stopgap arrangement, looking for another jobs as a pediatrician. But within few months, I realized that it is really interesting. Genetics is very interesting. And then I just continued learning, and then joined the department as faculty. And so the initial 10 years was a big struggle, learning as well as establishing facilities. So as I said, I came to this department just by chance. But then my aptitude for probably science, reading, writing, and learning medicine. So there was a all challenge. There was everything was new. So for everything I had to read and find out answers, find out diagnosis. So that probably I enjoyed, and then I stuck to this specialty, though we did not know what future holds.
Thank you very much. It feels like you keep saying you landed there like almost by accident, but you keep repeating one interesting word, that is, it was interesting. All the time you said you kind of discovered genetics being interesting and the rare disease interesting. So I'm just wondering, why, can you say a bit more, or why would you say something interesting is important to you?
I think the diagnostic challenge is is an interesting part as a clinician. And then gradually, initially, like there was nobody to look after these type of patients in India. Hardly any centers who could look after patients with genetic disorders. So naturally, for every patient, I had to read and find out the answers, and gradually realized very importance that uh, though though these patients may be small in numbers, but there should be at least few doctors who should take care of them. And that is how, like as I again say, that uh, reading about genetics, science, developments are like over 3 decades. It was the most fascinating part of the medical genetics. And once I started tracking that, there was no end to learning, and that probably I enjoyed.
I wanted to ask you about, in terms of the patients and how important patients have been to your work. And obviously, you know, we're aware of the importance of connecting patients with genetic conditions. And I just wanted to talk to you about how important connecting patients have been, or working with patients.
Really, I want to be personally attached to each and every patient and family. And for 30 years, I have seen the children whom I saw. Now they are grown-up adults and they come with their children. So connecting with patients is probably the exciting part which I enjoy. It may be like everybody may have different distinct personality, but I really love those patients, their families, and learn from them, because with the rare disorders, they have so many, they are facing struggle and they still cope up with their problems. Many of them are still smiling, and the parents try their best to get treatment for them. And all this really is humbling, and really it's a learning experience for us as doctors, how to cope up with our problems. So as because you said about relating to the patient, so I really love to be with them, and really feel connected uh, to each and every patient. So the numbers now are increasing, but still probably I have personal contacts with lots and lots of patients and families over these 3 decades.
Dr. Shuba, it's really nice that you're sharing with us this passion for patients and for families in a way. And sometimes, you know, we don't imagine doctors, medical doctors working in any field being so connected to the patient. Sometimes we imagine them connected to the illness or the passion about the diagnosis. But you're kind of giving us not only that, but also this picture that looking after patients seems to be an important thing in your career. And I'm just wondering, where do you think this comes from? How was this the rare genetic conditions influencing you in being more connected to patients, or would you say that you kind of grow up in a family that taught you those values? I don't know. Anything that you can share with us?
It's difficult to pinpoint like that, but um, personally, when I was a child and grew up, I was like used to talk very less, but now I retrospectively realized that probably I am receptive to other persons talking, expressions, and so on. So as I grew up and became older, probably more of empathy really I could express, and that's why the patients get connected, and then that is how it has to be bilateral. It's it's the bilateral good relations, and I said sometimes it's much more than patient doctor or friends. It is something different. And I would like to say that tell you that we publish a 3-monthly publication called Genetic Clinics through our Society of Indian Academy of Medical Genetics. And when I used to pursue such small episodes of some emotions of the patients, I used to write small things like under the heading, I write heart to heart talk. So many things. So I write such small stories, you can say, but they are like under the title of heart to heart talk. And then I realized that it is something called narrative medicine, where you keep patient at the center of the treatment rather than the disease at the center of treatment. So many things I was following, and then while I read, I realized that it is described as narrative medicine, and it's really so. Such stories I try to talk to my students also, that they should perceive that, and always make a small note in the summary about the interaction of the doctor with the patient and the family, and also between the family members, like the parents and the child, and the child and the mother, so and so. The small, so something are very interesting, something are very subtle.
Can I just, I know Nick has another question. Did you say that you are adding or encouraging your students to add more in these journals, a bit of the story of the relationship between the person and the patient? Is this what you're saying?
Yeah. So some stories are little more interesting, but still every patient and family has a very small story. Yeah. So what I try to tell them, that when we give a summary to the patient about her illness, diagnosis, investigations, genetic counseling, I say that you make a part B. One thing is scientific information about that particular disease, differential diagnosis, how you reach the diagnosis. So something minimum, though it may be everything is now available at your fingertips on internet, but still you have to make a small summary so that you keep it with that particular patient's records. And the third part should be small part about the psychosocial issues of that particular family.
Thank you.
That's so interesting, Shira, because it really reminds me of my experience as a patient here in the UK, and where I've connected the most and where I've felt the most kind of supported is when those principles are used, when it's kind of, when I'm put at the center of that, or my family are put at the center of that, and our kind of genetic condition, it's not necessarily second, but it feels like us as people is the center. And I think that's for me has made such a connection. It's probably why I'm sat here today, to be honest, because of that very connection with people within genetics. So it's great to hear that's happening for you and your team as well.
Over last few decades, and especially last 10 years, the things have changed so fast in India also, and they are now probably changing much more And with this probably COVID thing, everything is getting so systematized that probably it will be much better gradually. Everybody has got now a unique identity number, which is called Aadhaar card. And then gradually, probably if they get their medical records, lot of electronic health records, hospitals are keeping electronic health records and so on. So the record keeping becomes easier. And as I said, as the socioeconomic status as well as educational status of the parents have improved, so they are getting connected to each other, and there are many patient support groups.
How did that come about? Can you tell us a little bit about your connection to the UK? And
we used to send some case reports for publications to these journals, and then we used to get comments from Dr. Jill or Dr. Dan Donai and Dr. Carey, and if the diagnosis is correct as well as the paper is accepted, I used to feel very excited because there was nobody else in India to really tell me that my diagnosis is correct. So this was, and then I got this fellowship for clinical genetics of UK, as well as my husband did 1 year sabbatical in Preston as a neuro interventional radiologist. So I came 2-3 times during that period, spent some time in Manchester also. Like from Preston to Manchester, I used to come thrice a week for attend OPDs with Dr. Dan and Jill, and attended some lectures. So a lot of nice memories for Manchester. So these visits, though were very brief, but they are very, very important milestones for me in the form of diagnostic testing as well as learning clinical genetics as well.
So you kind of saying that these international connections, these connections with the UK had been important, interesting for you, and in practical levels, and also reassuring that you are doing kind of the things
in the right way.
that you are in the right way, or in the way that seems to be the right one. And you also are exporting almost or importing ideas from the UK to your own country. So kind of ways of doing things, maybe a little bit different, I don't know. Well, you probably have answered somehow, but I'm just wondering why in general this has been important for the patients in India, or for the services in India, and for yourself.
As I said, establishing diagnostic test. Now, probably my student don't realize that establishing laboratory, how difficult it is for a clinician. But for me at that time, going to the laboratory, watching those, getting my problem sorted, that was one thing. Secondly, as I said, the meticulousness of data keeping, whether it is in UK and USA, the importance of that and all those things, like they are engraved in my mind, and I try to do in bits and pieces, and probably still I feel that we haven't achieved that meticulousness of working in the lab or record keeping for clinical patients. That may be partly because of patient numbers also, but there are a lot many things to learn. Regarding clinical diagnosis and genetic counseling, as you are a genetic counselor and you feel there are many times lot of papers about genetic counseling issues in different socio-economic strata or different countries. Partly that is important to study, but many times I realize that human mind is same everywhere. So if you allow, I would just make a small, tell you about a small experience with Dan Donai, I think. I was in her OPD, and a family with 3 children, mother came with 3 children, and all 3 of them had, I think, MECP duplication or some syndrome, probably, as far as I remember. And the diagnosis they had got recently. Diane said that she is Dr. Shubha from India and she will be here if it's okay. Mother said, yes, fine. And then they talked to each other. Dr. Diane gave the diagnosis, and then she found the mother was probably, at least her question that what is the diagnosis was answered. That is a common thing in case of genetic counseling many a times. The final thing that at least diagnosis has achieved, though the disorder is not treatable. Then the lady uh, turned towards me and asked, do the mothers in India also want the diagnosis? So really, like, it touched me. And as I said, yes, mothers everywhere in the world are the same. So that summarizes probably that a human mind is same everywhere.
We hope you are enjoying the podcast so far. Please subscribe, rate, and review. Continue to follow our conversations where we discover that rare means different things to different people.
That really helps the doctor also to pursue for the diagnosis or maybe for the treatment.
Which is so. Sorry.
No, I was about to say, I do agree. I think it's the start of the journey. Once they've got that diagnosis, they can focus. And often that focus absolutely is scientific or treatment, but it also can be kind of socially and psychosocially, like what can happen now for this child? Can they connect them with other children with that condition? Or can they connect themselves with other families so they can share their experiences?
And also to notice in this thing that you just described, Shubha, how there's no one direction. It's how we all influence each other, patients influencing doctors, doctors being inspired by questions that, like the lady who asked you that question in Manchester, you still remember that question. It's so interesting. So it's quite encouraging. And also it's quite relevant in what is happening now, isn't it, Nick, in terms of COVID-19? And we know what COVID-19 is, but we still don't have a vaccine or the end. Yeah.
So it's a sort of irony that COVID-19, which was rarest of the rare disease 3 months ago, has become commonest disease.
Absolutely.
So this is a very, very different, absolutely different situation.
And I just wanted to ask you about your experience, both kind of personally and professionally, really, with COVID-19 and how it's affecting your work at the moment or the lives of your patients.
Of course, as you know, in India, the lockdown started quite early. Our hospital is a big hospital, and naturally we have kept the emergency services going on, and our routine patient load has really decreased. We had one big separate building, separate hospital, especially for trauma, and that hospital got converted into facilities for COVID patients because it's a separate and isolation is possible. All the doctors from all departments, they are now listed into duties for COVID hospital residents, as well as many other activities like transport, for quarantine, for diagnostics. So all 4 weeks had been a very big turmoil for the hospital.
So you kind of saying there are difficult challenges for clinicians, clearly, and hospitals and governments to make decisions. But we were thinking also, like, for us who have maybe family members that they are living with rare genetic conditions, or families here in the conversation that they themselves are living with rare genetic conditions. Would you have a word of advice? And we know that some people might not even have internet, or that different families will go through different circumstances, but there must be something common about the rare condition that maybe there's a bit more unsettling for them. And we wonder whether you would have a word of advice or an idea of what to say to them when they are a bit more worried than the rest of the population, maybe.
I agree so, but for the time being, probably who has more worries is very difficult to decide because everyone is so much worried. But of course, as you said, many people may not have internet, but now in India, most of the people are having these smartphones. And even India has made one app which is called Arogya Setu, means bridge to the health. And if everyone is supposed to download that app in the telephone and keep your record, and if you keep Bluetooth on, then if I go outside in the market and if there are other people around me, so I can get an idea that if there is any high risk person in that particular group, like who has a history of traveling to some place or is from a area which is a hotspot for COVID. So a lot of things are being done, and so hope so this situation brings us to a better India and better world, because I am very positive, because a lot of things has shut down. So when it restarts, we can restart with a better system, better at personal level. Everybody, my friends, myself, everybody are writing blogs and poems which are more positive. Everybody has realized that there is no need to buy any clothes for next 5 years.
Yeah. that was actually my final question. How personally, how has COVID, has it changed you in any way, or is there something that you will now approach differently, or is there anything that's come out of this that you personally feel?
Yes, it has given me time to rethink about priorities in life, to plan the things, as well as to relax. I say that if you don't take tension, then there is at least some time to relax. And maybe I shared with Charu my photographs. So in the morning and evening, I get to sit in my veranda for 1 hour. That is a really luxury. So the piece of sky which I see, and maybe those 20 trees which are there in my view. So one thing I have realized, that we have to work and still take out time for oneself. That's what because we have got carried away with work so much that it is occupying 100% of your time. So that is not good for oneself. And probably that is not necessary. Need to reorganize something so that some time is there for your body exercises and mind, like hobbies and everything.
Oh, thank you so much. It's just been great to hear your story and for us to share kind of our different experiences. It's been brilliant, and the time has gone so fast. Sorry, Shubha, it feels like we're cutting off a little bit, but we might go to Charu next.
And then come back.
And then come back, if that's okay with you, Shubha.
Yeah? Yes.
Yes.
Yeah, so would it be okay, just really 5 minutes to ask you, Charu? You've been very patiently sitting here listening the whole conversation. We don't want you to leave without sharing with us whether there was one particular thing or idea that you heard from Shubha that caught your attention and told you something about what seems to be important to Shubha, or her projects and her work in India now, that seems to be also connected to you somehow.
I think listening to Shubha, it made me realize yet again how similar we are.
Oh.
I was aware of this when I first met her more than 10 years ago, and this has just been reinforced listening to her just now. But the one statement she made, the human mind is same everywhere. It is so true. It doesn't matter where you are, this instinct of finding out why, whether you're a doctor, to help your patients, or if you're a parent, to get the best for your child. It's this inquisitiveness. It's this desire to know the next level. What next? How can I make it better? It's the same the world over. And that's exactly, I can see, is the stimulus. It's the excitement that Shubha has for her work every day. Is what I experience exactly the same. And the challenge of the rare is actually much more. So it's patients like Suyong who then benefit from all of that background work. It just resonates with me totally.
Yeah. And is there a particular image that comes to you, like an image that brings this idea of we are similar, the human mind is similar everywhere, this enthusiasm, this desire, the word that you're using is desire to know more. I don't know whether any image comes to you to kind of represent that at all?
I think of a jigsaw picture.
Mm,
I think there are clues everywhere,
yeah.
whether it's the non-verbal subtle cues when you look
Mm.
at the interaction between the parent and the child,
Mm.
whether it's the clinical clues that you're getting from meeting that
Mm.
particular patient, or whether it's the clues from your reading from the
Yeah.
literature. It's all a jigsaw picture. What you've got to do is to make that picture together.
Yeah, together. It's really nice
Yeah.
that you're saying that. And you said that this is really connected to you because you said that's happening to me. That your everyday experience as a
Yeah.
doctor and probably as a person. And
Totally.
I'm just wondering.
It's actually scary how similar Shubha and I are.
Ooh. Well, maybe it's inspiring also. Who knows? Yeah. I'm just wondering, having heard, I know you know each other, but you said it was almost scary to hear that, to hear this, to recognize that in you. What do you think this, having been in this conversation today, would add to you? What do you imagine, I don't know, sparkling in you, like thinking a bit different, wanting to do just because you've been in the conversation today? What do you imagine doing next because of this conversation?
I think the one overriding theme that came through to me was Shubha's perseverance for excellence, for the next step, to deliver more in spite of the limitations in the environment she is working in. I think for me, it is now to push from the diagnostic stage more to the treatment, to engage people more in that area, to drive it much more there, because that is where I perceive most blocks, whether it is availability of resources or funds or even interest.
Yeah.
Because these are rare patients, but they shouldn't be forgotten just because they're rare.
Thank you very much, Charu. I'm sure we will ask Shubha, and you can listen the podcast of the response if you really need to go. But it's really been precious that you could respond in such a clear way and in such an inspiring way for us and for the people who will be listening to this podcast. Do you want to add anything?
For me, it has been a privilege to listen to this podcast. I must admit, I was a bit wary, but I have thoroughly enjoyed it. I just wish I could have heard Suyog's contribution as well, but I'm really sorry I have to join another minute.
You will listen that.
We'll send it and you can listen, definitely.
Thank you so much for including me.
Thank you for joining us. Thank you so much.
Thank you.
Thank you.
Bye.
But I'm just wondering whether there was, and you can say a little bit more later, but whether there was one particular thing that caught your attention, that says something to you that was connected to what seems to be important to Shubha or interesting for her, or that connects with her values or the way she is working, that you want to share with us?
I think the experience which Dr. Shubha shared about, having a personal connect with her patients, that is something what really, strikes me, because I have similar experiences with my doctor as well. So since the time of this lockdown started, she personally messaged me, with all the do's and don'ts and the precautions I should be taking as a patient. So I really appreciate all the doctors in India for all the things they are doing for the patients and for their personal commitment which they have for all the patients. So yeah, that is something which I really appreciate.
And you connected with her because you also have been experiencing that yourself.
That's
and
right.
So what is nice or important or important to you about this constant connection that the doctors have with patients? Why would that be important to you?
I think it's a big moral support for them, that they are not alone in their disease, and they always have someone who is caring about them. So yeah, it's really important to have a personal connection between the patients and the doctors to make sure they are not alone and they don't feel left out.
And we know that you are an engineer, your profession, yeah. So I don't know what kind of an engineer image might come to you, but is there an image that comes to you in relation to this connection with doctors, patients, this not being alone at all? What would you say if that would be an image? What would you kind of envision?
That's a difficult question to answer. But, So yeah, so in these challenging times, it's as an engineer, I would say the technology is really playing a very important role. To have a connection between, especially when the patients cannot personally visit the hospitals or the doctors. So I think the technology is playing a really crucial role. Uh, for both the patients as well as the doctors to help each other.
Mm. So you imagine this connection through technology, but still you said you could notice the voice of Shuba or the text, the message that she's sending to you in those conversations with you. How do you think you've been touched through this conversation? What do you think this conversation has inspired you to do next, if there is a next that you're thinking of?
I think it's really important to be for each other in these trying times. To always have a personal connection and to make sure the patients are not don't feel alone, or they get the proper guidance, even if they are not able. There are many patients who are not able to have treatments at this time, because many of them have been advised to skip their infusions and treatments, as they are not able to visit the hospital, as it's a greater risk for them to visit the hospital. So at such challenging times, I think it's really important to have a one-to-one connection with the doctors. And yeah.
I'm going to ask Rona the same question, Rona, whether there was any particular expression or word that caught your attention in relation of what Shuba was saying and what is important to her.
I think the word that caught my attention was bi-direction, and that connection, she was talking about how much we learn from our patients and our families. And I thought as well, when she was talking about visiting Manchester and the things that she kind of like took back to India, how much actually we get from visitors coming to visit Manchester. And even listening to Shuba today, what really inspired me was hearing how she connected with those 70 patients. And that's really inspired me, and I hadn't thought about that. There's so much written, or there's so many leaflets, and I think at this time it's because the attention's rightly, there are so many people impacted by COVID, but then there are also our families that we would be seeing in under usual circumstances, and keeping that connection. It's been a real reminder to me. So thank you, Shuba, for that.
Is there an image that comes to your mind when you think about this bi-direction that you are describing?
Oh, I'm not really sure. Just as you said that, I was almost thinking like a sort of like a circle or something, some sort of roundabout or something. Everybody feels a little bit, in terms of how things connect. It was, yeah.
And how do you say this resonates with you as a genetic counselor working now during the COVID-19 here in Manchester?
I think hearing Shuba, it reminded me of how the joy of the job we do. I don't mean that to sound, but that was really what came across, your enthusiasm and joy, and sometimes having the space. I mean, Shuba was also talking about time, and sometimes our work, we don't have that time to really sit back and remember just how much we really gain from the job we do, the relationships you make and how much families teach us, and the opportunities to do and connect in different ways.
So having heard all these and having thought all these, I'm just wondering what would be next for you, having been in this conversation. What do you think it's been inspiring or touching you, sparkling you to move?
Yeah, well, I think, knowing Chiru and hearing Shuba, I think what we get most connection and joy from is actually meeting people face to face and in person. That maybe we will do things a bit differently, or give people choices to do things differently.
Thank you, Rona. Thank you very much. Thank you, all of you. Nick,
can I say something?
Of course.
I don't know what my role would be in this part, but I've been thinking as everyone's been talking. So obviously as Shuba was talking, and then as Suyong and Rona and Chiru, and I was thinking, what's really come across to me is that at certain points in our lives, we all need like an ally or an advocate. And I think, for Shuba, allies and advocates in Manchester and in the UK were really important to then feel strong and go back and deliver work in a different way or share her own ideas with them and get some kind of validation, I think. And for Suyong and myself as a patient at times, having that clinician or genetic counselor that is your advocate at the time and your ally that understands you and will fight for you.
Can I say something, Nick? I think you've been saying to us, to all of us, that you might never had a genetic condition or you might never been in this position, but now everybody who's been living through the COVID-19, which is everybody, we are a bit more vulnerable. So yesterday, Nick was my ally when I needed to prepare these questions for today, and I felt, I will not be able to. I was so stressed. There was so much going on. So having an ally is always something that I guess in any person in the whole world benefits. So. Yeah, we would like to give the voice to Shubha to finish, if that's okay, before we kind of close this beautiful conversation. And we're wondering whether, Shubha, you also been listening to to what people were saying about listening to you, and I'm just wondering whether you want to add something or you want to say something in this respect.
In fact, the first thing I want to answer is the question you asked to Suyong about what image of engineering comes to in front of you. So I thought that it is something like gears fitting into each other properly and both of them giving speed to each other. Doctor to the patient, patient to the doctor.
I would just like to add a fun fact about my association with the Manchester University. Because I was I missed elaborating on this earlier, but I was diagnosed after my blood sample was sent to the Royal Children's Hospital.
Oh wow!
Yes, because my doctors in India here they were finding it challenging to get a diagnosis for me. I was tested for various kinds of illnesses like thalassemia and other kinds of illnesses. I was I had to undergo bone marrow aspiration several times, but still it did not give any definitive diagnosis. So it was finally after my blood sample was sent to the Royal Manchester Children's Hospital that it was confirmed that I have Gaucher disease.
It's great because we seem to be able to, in all of these episodes, we seem to be able to bring everything back to Manchester.
So really, I enjoyed talking to you all. It's really my honor and pleasure. It was very nice talking to you all. And thank you all. Thanks, Charu.
Thank you to all of you.
Thank you for listening to this episode with our guests from India. If you'd like to continue with our conversation, please find us at rared.com and join our conversation on Twitter. We hope you continue to enjoy these rare international episodes. Coming up in the next special episodes, we'll be hearing from guests from Romania and the Mediterranean.
This podcast has been made possible by our brilliant team.
Rona McLeod,
Ramona Moldovan,
Jay Roach,
Maria Angels Ferrer,
Nicola Garda,
Fiona Oath,
Nick Jordan.